was one of my most difficult night shifts as a hospice nurse. I'm going to tell you why this was such a difficult experience as a hospice nurse, and then I'm going to tell you how you can prevent it from happening to you. So working nights can be hard as a nurse generally. Things tend to happen at night, which I'll get into in a second, and you're working with a skeleton crew, so you don't have much help. The story I'm specifically talking about was so hard because when I arrived to this patient's house, they were struggling to breathe. They had a change in condition. The family was, of course, upset. It was in the middle of the night and nothing was really prepared or ready. So they've just come on service. When I arrived at 2 in the morning to try to help them because this person was having shortness of breath and a change in condition, which usually means they were one way when they went to sleep and suddenly they woke up in the middle of the night, they're confused, they're lethargic, they're breathing different, they look different, and the family is scared. The reason why it was so difficult is because nothing was there that I needed as a hospice nurse. The family at the admission refused to get a hospital bed. They said, not yet. We don't need a hospital bed, not yet. They refused the comfort pack, which is the medication that would be sitting at their house for me as the hospice nurse who shows up at 2 in the morning. They said, no, we don't like morphine. We're not sure. We don't need that yet, not yet. Now, of course, the admission nurse respects what the family says. A lot of times, if I'm the admission nurse and the family is doing that, I will push and say stuff like, well, if something happens at 2 in the morning, there won't be anything here for us to do. But every once in a while, the family will still push back and go, well, just not yet. We get the importance, but just not yet. There was no oxygen there because the family said, just not yet. So when I showed up at 2 in the morning, they had nothing there. And the patient didn't have a hospital bed, so they were laying on the couch, which when someone's on the couch, it's really hard to care for them physically. It's hard to change them. It's hard to sit them up. It's hard to do anything because they are not in a hospital bed. Again, this is not meant to blame this family or shame this family. I understand. I get why this happens. But you don't know what you don't know. Hence why I'm making this video. I want people to understand how you can make things easier for yourself and for your family by prepping all of this stuff before. Later on in the video, I'm going to give you specific things you can do. So I show up to this house. There's nothing for me to do for this patient. I don't have medications to give them. I can't put oxygen on them. It's difficult for me to change them, to sit them up, to do anything because they're on this couch. They don't have any medications in the house to help with shortness of breath. Of course, we're a hospice company. I can call my doctor who's on call. I can get the medications delivered. I can do all the things, but that still takes an hour, maybe 2, even if we're super, super quick. Remember, this is the nighttime. This is 2 a.m. I knew what to do and I did all the things I could do, right? I ordered all the things. I made it all stat. I was hoping it would get there within the hour. And while I sat there with the patient and their family, they did not want to go to the ER. I did say to them, like, there's nothing really I can do until medication comes. The patient was in and out of being awake and alert and was saying, no, I don't want to go to the hospital. The family said, no, he doesn't want to go to the hospital. So of course I respected that. I stayed with the family. I tried to sit the patient up a bit and use a fan. Sometimes a cool fan can make someone feel less short of breath. But the person struggled. And the family, upset because they were watching their loved one struggle. It was hard just to sit there and have nothing to do until the medication could get there. And that patient died before anything could get there. They were already gone by the time things started getting delivered. And it was hard. I think I recorded a video a while back about that day because it was so upsetting for me, for the family. The patient, thank God, was so gracious and kind. One of his last words was saying thank you to me and to his family because we covered him up with the blanket because he was feeling cold. But it was still really, really hard. I always say my job isn't that hard. It's not that depressing. But when there's times like this where nothing was ready, nothing was prepared, and then basically the person struggled till their last breath because of that reason. Because there's only so much we can do if the person doesn't want to go to the hospital and nothing's in the home. I will never forget that day, and it makes me make videos like this so I can help that not happen again. So why nighttime, right? Why do things tend to happen at 2 a.m. in the morning? There is an actual reason. Our bodies have a circadian rhythm, and that circadian rhythm is working in our bodies all the time. And when it gets to be nighttime, our body shifts. Our blood pressure drops, our breathing slows down. And if someone is already getting towards the end of life, when that starts happening, their body can make even bigger shifts, which can cause a change in condition. Hence why we see a lot of symptoms in the middle of the night and a lot of deaths in the middle of the night. We also have melatonin production in our brain and temperature changes at night, which can cause hormonal shifts, which can cause confusion, disorientation at nighttime. We also see this a lot with people with dementia. Once it hits around dusk time, it's called sundowning, and it can make people with dementia more confused, more agitated. The body also can cool at night. Like I said, the temperature changes, which can cause someone to be a little more agitated, actually shiver, want blankets, want something to cover themselves up, but they can't do it. And that can cause agitation and confusion as well. We also have to take into account the caregivers who are caring for the people at night. They're alone, it's quiet, it can feel scary. They can be half asleep. They can be sleeping next to their loved one, or a lot of times they have a little baby monitor next to them and they hear little shuffles, wakes them up in the middle of the night. They're kind of confused. They're already a little out of it, super tired, super exhausted. They go into the room, they see their loved one having some slight changes, and it can feel scary. It can feel more scary because it's dark. You're alone. You just got woken up. So a lot of times we actually do get calls in the middle of the night. We go see the patient and they're actually kind of fine, but the family was just alarmed because you were woken up in the middle of the night. So how can you prepare for this? Here are some quick and easy tips for you to prepare your home to have a peaceful overnight experience. I'm going to get into how to actually prepare your home. But the first and foremost thing I want to say is when your hospice company comes in to admit your loved one into hospice, say yes to all of the things. Say yes now, even if you think I don't need it yet. You never know what's going to change and how quickly it can change, and it's better just to have things there. So say yes to all of the equipment, right? The hospital bed, the bedside commode, the oxygen. Now, not everyone needs oxygen. It's over-ordered, but generally speaking, if your loved one has had any form of shortness of breath, you can always get the oxygen. Say yes to the comfort pack and get it delivered that night. Comfort pack, get it delivered that night so you can have medications in the home just in case something happens. And number 3, call your hospice company. Never wonder, should I, shouldn't I? When in doubt, call the hospice company. Even if it's 2 a.m. and you're not sure what's going on, or maybe it's no big deal, call them. Have someone come out just in case. So how can you prepare your home to have a peaceful overnight? Number 1 is lighting and layout. You want to use some night lights so you're not tripping around, or your loved one's not tripping around just in case they get out of bed. So soft night lights or a soft lamp outside of the room, some form of soft lighting throughout the house to keep you guys safe from falls or getting disoriented, things like that. I would usually recommend having the hospital bed in an open area, possibly a chair next to it for someone else to sit in if they need to, and a bedside table with supplies on it. If your loved one is still alert and oriented, they could grab whatever they need. And if they're not, you can have the supplies that you may need at the time. Generally speaking, you just want an open area. I always suggest not having loose fitting rugs laying around as well. That'll help decrease chances of falls. The comfort pack station setup. This is next level and I love it. So you're going to always say yes to that comfort pack, which has medications in it for just in case something happens. You can actually, especially if you know your loved one's going to need medication in the middle of the night, maybe need an Ativan, need morphine, need Haldol, whatever, you can pre-draw up syringes and have it ready. So hey, if I wake up at 2 a.m. and I hear them moaning, you already have a syringe drawn up. You don't have to think about it. It's already there. So you can have a station set up with the meds you usually give. Practice, drawing up the morphine or drawing up the Haldol so you get used to being able to do it. So if it's in the middle of the night and you're just waking up, you already know how to do it, or maybe it's already set up there for you. You always want to have extra disposable pads around, wipes, gloves. Disposable pads, I call them chucks. There's the things that you have that lay under your loved one just in case they need changed in the middle of the night or something happens. You have gloves there, you have the pads there, you have wipes there. And then of course those oral swabs, which are the stick with the sponge on the end. I love those things, right? You can use them to try to remove terminal secretions, or you can dip them in like ice cold water or apple juice or grape juice, whatever your loved one likes, to moisten their mouth in the middle of the night if they wake you up because they're seeming agitated or seeming like they're in pain. You can do different things to help kind of calm the room, calm your loved one. And last but not least, preparing yourself on what is expected. At the end of life, many things can happen that can feel like an emergency. I have many patients of mine, many families of mine say, what do we do when they stop breathing? Do we call 911? So we just let them stop breathing? They don't fully grasp that like their loved one's going to eventually stop breathing. And that's technically not an emergency because we know they're at the end of life. Fully asking all the questions to your hospice company, fully understanding that your loved one may suddenly be breathing differently, right? They may suddenly have a noisy, gurgly breath. That stuff is all normal and to be expected at the end of life. So preparing yourself for what end of life can look like, what's normal, right? What's not normal. All of my videos can help with that. There are booklets that hospices usually pass out that you want to educate yourself on. So knowing what's normal, knowing what's to be expected. So if you wake up at 2 a.m. and you see your loved one who looks really comfortable, like they're just sleeping, but they're breathing a little different and their breath sounds a little wet, you can still call your hospice company, of course, but knowing that that's actually normal and they're likely okay, especially if they look calm, right? That's just part of the dying process. So preparing yourself and knowing what it looks like will help so much and be able to create a peaceful night for you and your loved one. Caring for someone can be so overwhelming, specifically in the middle of the night if you're the only one there. So please know you're not alone and call your hospice company if you need.